Hi, welcome to ThriveTalk, Northeast Ohio Thrive Magazine's video podcast. And I'm Marie Eliam. I'm the editor of Northeast Ohio Thrive. And I'm really excited today to have as our guest Jennifer Beach, who has been a longtime writer for us for the print issue and a blogger with topics on caregiving. She writes Caregiver Corner. Let me say that first off. And she is the founder and owner of Advocate for Elders in Rocky River. Mm-hmm. And she is a licensed social worker, and she's also an advanced aging life care professional. Mm-hmm. So she knows a lot about aging issues, and some of her columns have ranged from, can you get yourself off the floor, dementia, sundowning, friendships, why change is good, or how to navigate change. And so I wanted her here today to talk to us a little bit. I mean, you cover all kinds of topics, but for our purposes today, we're going to talk about how people can advocate for themselves or for loved ones with doctors and in a hospital or with medical visits or whatever, because I think a lot of us feel vulnerable in that position, and we're not really sure how to do that. We're just so grateful the doctor isn't 2 hours behind and shows up. I mean, honestly.
That's true.
My dad's 90 and he's fired 2 doctors in the last year. He walked out after being kept waiting for a half hour. He said, "I'm 90 years old. I don't have this much time to wait." That's what he told the nurses. So, but that's him. So let me turn it over to you, Jennifer. What is the main challenge you see with people you work with and dealing with medical professionals?
Well, let me just first say thank you very much for having me, and I'm excited here to talk with everybody. And it's been a real pleasure and an honor to be a part of Thrive, the community, and it's fun picking out the different topics, and they're all relative. They're just things that I come across day to day when I'm out in the field doing my work, and whether that's in someone's home that's caregiving, or in a senior community, or at a hospital, or medical appointments, which is kind of what we're focusing on today. So, I think everybody knows, as your father has realized as well, how busy our health services are. Although they are flawed and there's lots of issues, they are still the best in the world. I mean, we have people from all over the world coming, to, especially here where we are as well, because we have so many great healthcare systems. Yes, there are issues with everything, right? There's nothing that is perfect, but if you can help prepare yourself for those interchanges with these health systems, you'll be a little better off. And that's being your own advocate, or if you're not in a position to be for yourself, whether because you're the patient at the time in the hospital bed, or you are with one of your loved ones, advocating for them because they're not in a position, or you're just by yourself because that's, where you are and you're off to the doctor's office. So some things to keep in mind is, first of all, have realistic expectations. There is a chance you're going to wait. And especially in some of the key, very, very busy fields, like typically orthopedic, right, is just a very, very busy, high volume. You get into geriatric care and services. It's, there's just so many of us boomers and so few, trained geriatricians and so forth. So, kind of go in with some expectations. If you think you're going to pull up and 5 minutes later, you're going to have your appointment at 10 o'clock and you're going to be out at 10:15, you may find yourself very frustrated. The other thing is be prepared. So bring a water, I always say, make sure if you need to take your medicines before, or if it's right at lunchtime and that you get kind of, weak, or you feel good because you're not eating, bring a snack.
Yeah, right. Okay. Oh yeah, that's a good idea.
Bring something to read. I hope not that you're camping out, and I hope it's not that way, but that way you're just in a better mindset that, I'm going here. So, kind of think through if you're scheduling an appointment for somebody that does have a chronic condition and going to a medical appointment is, a big event of the day, don't schedule it at 8 a.m. if they're not a morning person. You're setting yourself for up even, more difficult and challenging situations. So the best you can, and I realize we don't always have options, as much as we like, but when we can, think of those things. Think of the time of day. If you're scheduling it in February, there is a big chance the weather could be a factor. So, just, try to be a little proactive. As we have talked about before, your attitude going into it, if when you look at someone and say hello, and you can introduce yourself, you can say thank you, it goes a long way. They, as much as we are frustrated with how behind or how short the time is, they're just as busy. The nurses and the aides and the people that are serving us are many of them are working, overtime, and they're seeing so many clients and for patients, and they have, busy lives themselves, and they have trauma that they're going through in their family. So just sort of that basic courtesy, right? Hello, thank you. Even when you don't feel good, if it's possible, the best you can, that goes a long way. Go in knowing about yourself. I say, you should have your own infomercial if this is on you, or the infomercial for your loved one. And what I mean by that is, can you in a minute or less, kind of know what's going on? If you have a major history, if you're in the middle of a chronic condition, you should be able to say that, to know what's going on in your life. If you should know your medications, and I know the names of them are horrific. I can't say half of them.
So hard. I just call up my chart. I go here, or I print out I do a screenshot. I go here.
Yep. And today there's just so many ways that we can access it, but there's nothing wrong, with a good old notebook too, which can be great because you can reference, right there, kind of just keep it and take it with you to appointments. Even though you might go, if you're very healthy and lucky and you're just going once a year or something, still write down, make a few notes, jot, what did you talk about? What were your concerns? Write down your medicines or take a screenshot of them. Or if necessary, if you're, bring in your bottles of medication. It shouldn't be a surprise. Or, I hear so many people say, I don't know. I don't know what I take. Or how long have you been taking it? Or why are you taking this medicine? Do you know what it's for? Do you know who prescribed it? Because a lot of times people are sometimes they just sort of get on that wheel and they're on something. They don't even know why they're on it. Right. And they've been on it for years and years and years, and no one's sort of asked questions about it.
Everything's so specialized too. So you see a cardiologist and then some other kind of and there's all kinds of things working at cross purposes. Sometimes it seems, especially with older people, they're on all kinds of medicines, and it is confusing, and you're not really sure why they're on stuff. Who knows? Yeah.
And you may hear a cardiologist, you ask a question, they'll say, oh, well, you'll have to talk to the gastrologist. I only deal with the heart.
Right. And don't you think that's so hard for people who aren't doctors to understand? Well, I don't know, you went to med school, didn't you study the whole body at some point? But everything is just broken down into body parts.
Yeah. And it is hard, and it is, we are slowly, we notice changes, right? Trying to be more holistic and looking at the bigger picture of things. Now we're very focused on how food is affecting our system. You see a lot of that out in the news and so forth. So, we're learning, and there's lots of changes, but just like, a plumber comes into your house, and he's going to look at your plumbing, and he's going to realize, well, the sewer effects, but he's not necessarily a specialist in that area, or he doesn't know, or she doesn't know more about. So, we can't expect someone like our primary care to be this all encompassing and have, education and knowledge about every part of the body. It's just, I think there we get sort of this expectation. We just want one person to tell us.
Yeah. I want like Dr. Bombay from Bewitched. I just want like one person to be in charge a little bit. Well, I think that's interesting what you said about being able to summarize why you're there in 30 seconds or so, because I think sometimes we get into a habit of storytelling, like, well, back in like about 6 months ago, I was like, blah, 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 and you have to be able to condense this.
Yes.
And then let the doctor pull the strands or your PA and figure out what's germane to the situation, I'm guessing. But
absolutely. So if you can, you've got that 15-minute doctor appointment essentially, or however long that they're scheduled. And that's typical is a 15-minute time slot, right? To come in. And so people, we often walk in and we're talking about basically the things that's just happened, the most recent thing that's going on.
Right.
So that's why when I say you need to be prepared, and there's some key things to bring in from your last appointment. So if you saw them 3 months ago and you've been trying a new medication, or it's been 6 months, you should be, looking back for yourself or your loved one. What's happened in that 6 months? Has appetite changed? Have you lost weight, gained weight?
Okay.
Has there been a major event in your life, a stress event? Have you, lost someone that you love? Are you dealing with major financial issues?
Okay.
Not that your doctor wants to hear about your personal life,
Correct.
but those are significant life stressors that can affect our health immediately. How are you sleeping? Not just this past week, but since, you've last been there, are you sleeping, or your loved one, are they up at night, roughly 3 times a night? Or do you go to bed the same time, get up? So you want to do, your own little research and data collection on yourself.
Okay.
The best you can. So you're coming in and saying, hey, I haven't seen you in 6 months, but I have to tell you, I lost a good friend of mine. I've lost, about 5 to 10 pounds without trying. Am having difficulty sleeping.
Yes. Okay.
I'm trying a new supplement that I heard about online.
Yeah.
So it's very, very important to bring up, know your meds, but what supplements? People don't think, oh, it's just, I'm mixing this in my smoothie, or I'm doing this.
Right.
But we don't know. And those are important. They're all contributing, to your overall health.
Okay.
So you want to, and you're right, you have short amount of time. So you want to have this, you can't tell this big, long story.
Right.
It's almost like bullet points, but there are bullet points that are extremely important. That is your mood, your sleep, your appetite. Okay. And then pain, right? We want to talk about pain. And oftentimes, people, they'll say, what's your pain? 1 to 10 when you're here today. And if you're sitting there and you're feeling great today, it's nothing, but you should say, usually when I get going, my pain is 0, but at night, my pain is like a 7 when I'm laying in bed.
Okay. All right.
So being prepared is so important.
Okay. All right. And then that's something that if you have someone go with you, then they can, or if you're the person going with someone, you can ask them that. So you're prepared.
Yes.
Like they can do their own talking usually, but then you can also remind them like, oh, remember you said that you have not been sleeping very well. You're up at 4 a.m. or whatever.
Yeah.
Okay. That makes sense.
Another good thing to do with a loved one or someone that you're going, you're helping them out and you're taking them to their appointment is, take some time before you go in and ask them, do you have specific questions? We've kind of covered, we've been talking about these things, so we're ready to share with the doctor. And you're right, you want to let obviously the patient speak for themselves. But if for some reason they aren't able to communicate, effectively don't want to, they've given you permission, to share, then, you do want to bring up their questions for them. But at that appointment in the middle of it isn't the time to ask somebody, what is there, what questions do you have for the doctor? Because
Okay.
it puts you on the spot, and all of a sudden you're like, the doctor's looking at you, and
I've got your mind goes blank.
Mhm.
Right. That makes sense. What are some other tips to use, and I'll present it in a negative way, or things people don't do right that they need to be better at when they're going to a doctor's appointment or have a hospitalization and all these people are coming into their rooms. I've always found it confusing when I've been with my parents, whenever they had been hospitalized. People will come in and they sometimes don't introduce themselves, or like my dad would say, some doctor came in, I think it was the heart guy. I go, who is this guy? Do you leave a card? You have a notebook here, So then I go out to the nurse's station. I said, who saw my dad? Who is this person? What is that person's specialty? I don't know, dad will say, it was a woman. She pressed my stomach or so. I'm like, who is it?
Yeah.
It's so confusing.
Well, too, I mean, we're talking two different things too. When we're talking about being prepared for medical appointments, we're sort of in a different state. When you're in the hospital, it's a whole different, same principles are important, right? Commercial. I mean, your infomercial, if you can, about yourself or your loved one, right? Be prepared, to say it over and over. People get frustrated when, how many patients are in the bed? How many times do I have to say my name and my date of birth? Every person asks. But you know what? It's a safety check. It's a balance. I mean, errors happen. So as frustrating it is, it's actually a good thing. So those are some of the things that if we can sort of accept, there are certain things that just have to be done. And you're right, people come in and out of there. And if you are able, if you're the patient, if you're able, or if you are there advocating for someone, introduce yourself and ask them who they are. You're right, they should introduce themselves, but they may be, running from who knows what to who knows what next. And, so some of those, kind of niceties that, and communication skills may be on the back burner. So, if we need to step up and kind of help the situation.
Okay.
Take some responsibility. Some other, things are, ask questions. People go into the hospital, and now, as we were talking about earlier, if there's an emergency, an acute situation that is happening and you're in the hospital, the hospital team is there and they're doing their best they can. That, we're not in the middle of that acute situation asking 1,000 questions. But when we are now back in our, recovery or our room and you're staying there, it is okay to ask questions. You are now feeling a little bit better. This nurse comes in and says, it's time for your pills. You should ask, what pills? They should be telling you what they're giving you, but maybe you were sleeping, or maybe, they told you last time. So they're not, but you really should, if you're able, or if you're with someone, when they come in, ask, okay, what pills are we getting? What time do they get them?
Right.
Ask questions, has anything changed with my medication? Is it the same yesterday? Am I still getting that antibiotic?
Huh.
It's okay. This is about yourself or your loved one. And remember, that medical team doesn't always have time to tell you all these details.
Okay.
It's, we are a part of the equation. It's just a different world now. There are more people. We are busier than ever in, medical settings. So we're a part of the team, and this is you. This is about you and your body. And so this isn't anything that has to be confrontational, negative, anything, you just want to have good assertive communication, because this is your body and you need to know. And, as we all know, sometimes we come across people that are easier to communicate with, or, or much kinder, we feel, or we connect with, and other people, they may have just as great skills medically, but, they're not, their bedside manner is a little bit different.
Right.
Or they're busy. We can't just focus on just that issue. We just got to.
It's not a personality. You're not going on vacation with them.
Right.
You're trying to get medical care from them.
And
It's
guess
like,
what? The food is typically not good. I mean, a lot of times, your people say, oh, the food is so bad, or it was cold, or, I mean, that's really not their role.
yeah.
And a hospital, I always say, when you go into an emergency room, they're there to treat the acute situation you come in. They are not looking at the whole big picture and everything. That's not their role. They're
Yeah.
coming in to stop the bleeding, to address the break, whatever it is. And then you have to follow up for your loved one or yourself, on all the other steps that are to happen.
Mhm. That's a good point. I know a couple of times when I had been in the hospital, for like an extended period, and I keep getting like different medicines. And then I was like, do I still need this medicine? Like, why are we giving it? I thought we were giving it until X happened. And then they'll communicate with the doctor and they'll be like, no, we don't have to do that anymore. You're done with, but it's not because, I mean, I'll do whatever they say, but sometimes, I think things slip through the cracks, or they're just doing it, not just, but they're doing it prophylactically, and it's maybe not necessary completely, especially if it's like a shot or something that hurts. Or, I'm like, do I really need this? And like, no. As a matter of fact, you don't. So it's worth asking if you're able to, or if you're the person, your advocate, remembers to do that.
Yep. Absolutely. You take time to ask the questions, and the other kind of jumping back to just for doctor's appointments and so forth, you know as best we can for ourselves, look at all the areas people, it isn't just that medical appointment, but are you going to the dentist? Are you going to the eye doctor? After a certain age, people take this so negatively. I mean, aging is a great thing. Every day it happens to us. That means that we're living another day, right? We're aging.
Yes.
And as anything that ages, things wear out.
Yes.
Things need to be addressed. And so to just completely ignore, key areas, we're putting ourselves at great risk. So although, it still amazes me, hearing aids have such stigma. I mean, people just don't want to. I mean, hearing loss happens to so, the majority of people as we age, and it has such a profound effect on so many other systems in our body, including falls. So how many people fall and they're hard of hearing? But they don't want to wear that hearing aid. And the earlier that you can adapt and accept these changes, the better it's going to be. It's really hard sometimes to get a 90-year-old to have a hearing aid, because they may not want to. It's just uncomfortable. Things sound different. There's an adjustment period. Maybe they're not understanding the technology, or, so, but really, if you're 59, you're 62, and your hearing is changing, that's the time, because then you can be a part of it. You can, learn about it, adjust it, adapt to it, your body, your mind. So then as you continue on, you're in a much better position.
Yeah, that's true with a lot of things too. Just trying to stay limber, getting yourself off the floor. I was like, I should make sure I can still get off the floor. It's not pretty, but
that's okay. And if it's hard, then you know what? Then you should try it.
Keep doing it.
Once a day, or
absolutely. Absolutely. That's funny. Is there any other important point you want to get across before we wrap up our session today? Because I mean, there are so many other topics I really want to talk to you about, because like I said, your columns for the magazine and on Northeast Ohio ThriveTalk are just terrific. They just cover really great topics that I think would be helpful to a lot of people. But in this arena that we're in today, anything that you want to
Well, I just think, what's important. I mean, I have the opportunity to be with, so many different people, so many different families, and, we're all so very different. Every situation is so unique. So everybody's approach to things is different, and that's quite all right. The important thing is, that I couldn't stress more just if people would, just take those few minutes to write down their medications, to know what they're taking, the dose that they're taking, just do a little bit of preparedness, because you know what, that medical provider is going to engage with you differently because you're playing an active role.
Okay.
You're interested in what's going on. If somebody comes in and they really don't care and they say, oh, well, this is who knows, whatever, it is what it is. I don't really care. I'm going to die. Then, I mean, what different, the doctor, how much does he want to invest or she want to invest in somebody that just, doesn't really want to even 1 ounce participate in their health. So, the more that you can, accept, prepare, participate, I think the better off you're going to be, or for your loved one. It's not going to change the disease. We can't take that away that's happening, or, the frustration. Believe me, I've sat many, many times. I've been the patient in the hospital bed, I have felt all of those things. But we have to keep coming back to, I don't see any of us running off to other places to get care. I mean, we're in the best that there is.
We are, I think that all the time, and I'll have friends who are like, I want to go live out in the middle of nowhere, kind of off the ground. I go, really? I want to live within an hour of really good hospitals and a good airport. Okay. An airport that can get me to see my kids and grandkids, and by good hospitals. I don't want to, you don't know what's going to happen. But we are fortunate in Northeast Ohio. I think about that all the time. So, but Jennifer, thank you so much for your time today. I appreciate it. And in our show notes for the podcast on, you'll be able to find the podcast on YouTube or on whatever streaming platform you use, but also on our website. And I'll have information on how to contact Jennifer, and also how to get more information, and you can access her terrific content too. But thank you so much.
Absolutely. It's great to talk with you.
It's good to talk to you. All right, let me.
Okay.